Happy Dipawali days to all over the world, my friends and patients. You know, Dipawali is a festival of light, but due to firecrackers, elderly heart failure patients, weak heart patients are going to succumb. They might suffer from increasing in breathing problem, and they might suffer from congestion in the body. So heart failure patient and heart patient should refrain from firecrackers or use mask to protect from air pollution, because this is winter and firecrackers pollution, diesel pollution will deteriorate the lung condition and heart condition and leads to infection, and that can lead to pneumonia or myocarditis and aggravate compensated heart failure into decompensated heart failure. Means heart failure की कंडीशन बिगड़ती है तो उनको हॉस्पिटलाइज होना पड़ता है. तो अवॉइड फायर क्रैकर पॉल्यूशन and avoid going outside so much, and avoid sugary sweets. Instead of use dates, fig, anjeer sweets, sweetness sweets, and it should be in the limited, and avoid fried food in this Diwali season. Otherwise, you have to rush to hospitals, and you know that in hospitals, once you go, they will not relieve you without doing bypass or stenting. First, they will do angiography and show blockages without ultrasound, and you will be trapped in that blockages problem, and doctor will forget, but you will remember till it is shown in their angiography graph. So be careful in diet, avoid air pollution, this is must. And right now, why mainstream stent and bypass surgery doctors are avoiding enhanced external cardiac counterpulsation treatment that is approved by USA FDA, Canada FDA, India FDA, Saudi Arabia FDA, Dubai FDA, Russia FDA, all over the world FDA. Every country has passed this treatment for heart failure and intractable angina to treat as a natural bypass. But hospitals, management staff and doctors convince patients in a negative way. But real factor is that FDA doesn't approve any procedure without vigorous clinical trial. So don't trap in angiography blockages without ultrasound done by hospitals in India. A rare hospital done use ultrasound IVUS. Otherwise, daily 20-25 angiography they do without ultrasound or with same catheter. And during procedure, I have seen that lot of patients succumb. I have lot of patients coming after bypass surgery, then they put stents In spite of that, they have to take 20 self-sorbitate to relieve their chest pain, or some patients succumb during surgery or angiography. So adopt healthy lifestyle dietary pattern, green plant-based vegetarian diet, and those who are non-vegetarian can eat roasted fish once or twice a week, or boiled egg once or twice a week, but not fried any non-veg product. And vegetarian also should avoid fried and deep fried and trans fatty acid rich vegetarian product. And you know what is this trans fatty acid rich product? That is potato chips, bakery products, pizzas, burgers, cutlets, samosa, repeatedly heated in one oil. That is very, very damaging. You can enjoy Diwali by few sweets of dates or anjeer, sweetness sweets, and take homely fried food occasionally, once or twice in a Diwali time period, but that oil should be discarded. And I am a certified EECP specialist. Why EECP is not so much in a limelight? Because some nefarious doctors, I say this word, give franchise to non-medical persons and take 30 to 40% and give one old machine or one Indian-made machine or anything, refurbished machine, and they, non-medical person, hire any local doctor and run the center. That's why people sometimes misguided by review rating or advertisement. But ECP is a treatment that is very deep scientific treatment. If you take by trained certified ECP specialist, I am a trained certified ECP specialist by international ECP body. So don't trap in reviews. Yesterday one guy calls me, sir, give me 100 rupees, one review in Google listing will be increased. More you give, if you give lakh rupees, your Google listing will be 4.9 or 5. But I don't convince, because I have to treat the patient. I am not doing business. I believe in humanity, ethics. That's why without advertisement or any paid gimmicks or podcasts or paid TV channel interviews, I am successfully running 2 EECP centers under my guidance and getting excellent results. But somehow some patients frustrated, after 4 or 5 years, some pain occurs due to their bad dietary habit and bad habits. And we advise them to take some medicines to change and to take antithrombotic injections. But they don't rely on us, and they go for surgery or angiography. I had one patient. He go for angiography at government hospital, and during angiography and after bypass surgery, he succumbs. He dies. This is the problem. When you take EECP, keep totally trust on it. It is a wonderful treatment. I have treated patient of heart transplant advice patient. Since 8 years, their pumping increased for 15 to 45, 50, and he is Himmat Bhai Patel is doing farming. So imagine the benefits of EECP. Normally 30-35% patients pumping jump to 60%. Means arteries are going to open, new arteries, vessels are going to develop surrounding the blockages. Blockage arteries, culprit arteries is going to open. Vascular growth factor, nitrous oxide secretion, stem cell secretion occurs during ECP. Afterload reduction occurs, cardiac index and cardiac output increase. But ECP should be taken by trained certified doctor. No DM or no other doctors that says that I am a cardiologist. But if he has not taken ECP training and certificate, that is not useful. He cannot give you proper treatment. So enjoy your Diwali with healthy food, avoid pollution, and enjoy the period, this period as a not patient, fully enjoy it. And ECP patients, after taking ECP, they are enjoying their life. But I again request that avoid pollution for heart failure patients. Wear mask. Don't eat sugary, starchy items. Instead of sugar, use dates, figs. Don't use artificial sweeteners, they are also damaging. And don't use saturated dairy products and its byproducts, ice cream or lassi or shrikhand. That is nonsense. And don't use trans fatty acid rich food and like pizza, burger, cutlets. Avoid it. And don't drink soda and cold drinks, that is liquid death. Otherwise, enjoy your life. Eat homely food. Don't eat outside food, because outside food is fried in palm oil or vanaspati ghee. So enjoy homely food and enjoy natural food and enjoy green Diwali. Thank you.